It's a challenging task to keep everybody on the concentration after lunch. We are speaking about self-help groups. From where did this term come? Can anyone think? Can anyone think about 70 years back? We started with our own. We used to have small groups of women sitting down together and helping each other. If somebody needed something, by giving like a barter system, sharing the rice or the vegetables. That's where the self-help group started. When we were in a meeting in UNESCO, they said, you know, India is rich in charity, but they are still poor. They are rich in group discussion, but they are still poor. The health-seeking behavior trends. We are the most women to women. And we are the most richest people where we can have our own resources. As you are sharing the 4 questions on mental wellness, I turn it around this way when I go for health education. Last 3 months I'm trying to do health education with the villages in and around, and once I try these questions around. Instead of asking, are you sad? I just ask, who in the class cried last 3 weeks? In a group discussion, because we are population. Each and every one with a questionnaire. We have a group, like here in a group. We just ask, who among yourself, the colleague, forgot the wallet at home? And why do I ask this question? If there are ladies, who among your colleagues forgot to wear a watch? Who among yourselves forgot to wear a matching blouse or a sari? Who among yourselves is wearing an opposite color? Because this is the first alarm of depression. And the first alarm of depression is oxidative stress. I had been to a village about 1 month back. We are using IT and other things. I asked them, what can we do with IT? They said, Madam, current 24 ಗಂಟೆ ಇದ್ರೆ ನೀರು ಬರುತ್ತೆ. ನೀರು ಬಂದ್ರೆ ನಾವು ಏನಾದರೂ ಮಾಡಬಹುದು. 24 hours electricity. And we are thinking of these solutions. 60% of them are still not aware about how to use the handphone. So I did a screening for them, started doing a screening, and it spread in just 5 minutes that there is a doctor in the village, and there were 120 women. That's the strength what we have of health-seeking behavior. Then I asked one of the lady, can you do one thing? I gave them a product from Karnataka Antibiotics Limited, and I told them, just have this, and give me how you feel a small voice after 15 days. As I was flying back about a week, I saw an audio clip from one of the members of this lady. She sent me an audio clip. It was for 12 minutes. I thought this should be a song or something, and I'll see it later on. Just imagine what was that. She recorded a clip of every woman speaking to me on that 12 minutes, and she sent me on WhatsApp. I was walking in a city, this whole city is Wi-Fi in Germany, Ather. They did it, the whole city on the internet, because you have this mobile solutions. As a old, there are more of old people in the city. You have an ECG which they have to keep, and the data goes right to the mobile of the cardiac surgeon through the Wi-Fi. The blood test, the blood pressure, ECG, and also their sleep. So that's why the mayor of the city made the whole city Wi-Fi free. So I was just then and I got an audio clip. And I thought maybe this is a song. So I was waiting till my colleague comes and picked me up, and I heard it. They said, as you told us, we are doing breathing technique in the morning. I am doing, so I don't have digestive problem. ನನಗೆ ಇಲ್ಲ, ನಮ್ಮ ಪಕ್ಕದ ಮನೆಯವಳು ಮಾಡ್ತಿಲ್ಲ ಮೇಡಮ್, ಮಲ್ಕೊಂಡು ಬಿಡ್ತಿದ್ದಾಳೆ, ರಾತ್ರಿ ಎಲ್ಲ ಹತ್ತಿಬಿಟ್ಟು ಅವಳು ಇನ್ನೂ ಊಟೋಗ್ಬಿಟ್ಟಿದ್ದಾಳೆ, ಔಷಧಿ ಕುಡಿದ್ರೂ ಏನೂ ಆಗ್ತಿಲ್ಲ. You look how the strength of community is. She is speaking not for her, she is speaking for her neighbor to me. In that 12-minute clip, one clip was this. Then another clip, she's speaking for her daughter-in-law. She's saying she's pregnant and you advise her and she's not taking. The same 12-minute clip I'm getting. And the daughter-in-law speaking about mother-in-law, she had sweets even though she's diabetic. So this is our screening data, this is our self-help group strength. So if we have to screen, we have to do it in a group, because nanigilla avulagide, avulagidare ide, All Huxley toilet book. The school, the children, we are missing the children for screening of pre-diabetes. The children speak out saying that he goes to the toilet 10 times. Right? And they don't speak about bedwetting. If we ask them, what did you dream last night? They give you the dreams of fear. Then you ask them, did you drink water when you are sleeping? They say, no, we don't drink water when we are sleeping. Neer kodalla, amma neer kodalla malgovaga. Yako kodalla, yakadre nan toilet ಮಾಡ್ಬಿಡ್ತೀನಿ ಬೆಡ್ಡಲ್ಲಿ. Why he is doing bedwetting? It is because of this depressive disorder. We have preteen, we have teen, and there's one big beautiful caption. Boys cannot cry and girls cannot laugh. Where do the boys cry then? How are they controlling their emotions? They again speak among their groups. Not only in the villages we need self-help groups, we also need even here in the cities. Even here you had kitty parties. The 1980s and the 1990s where the working women had kitty parties where they had this group of women. They are the self-help groups. Even in your own company, you are a group. That's where is our community strength and that's where is our community outreach and helping each other. At least we're speaking out of simple clothing. When you chart out a menstrual cycle, premenstrual syndrome, there is breast tenderness and of course they cannot wear those clothes that day. They have breathlessness. And how do you bring it out? Just speak out. You can just try to get them out. Talk to the children. Talk to them. When they come back home from school, hardly they are having parents to greet them. When they're sleeping, hardly they have parents. In Bangalore, hardly the parents, they just go peep into the bedrooms. That's what most of the children write to me. That's what they're coming and telling me. My mama peeps only in my room. She comes at 11:30 and only I have to get the grades. 90, 90, 90, A+, A+, A+. My job is to study. That's it. What's the life out of it? 4 questions like we had of depression. Now you ask, what did you dream? What wonderful dreams these kids have. Someone wants to sit on a horse and ride all around Bangalore. You see the dream, sit on a horse and ride all around Bangalore because there is traffic jam. Look, this is a dream of a 10-year-old boy. And a dream of a girl, she wants to have wings so that she doesn't have a traffic jam when she comes to school. These are giving us what level are the emotional stress into. They would have seen the father and the mother fighting who will pick up from the school, who's going to be there. And then in the school, you ask them anything, did you understand concentration problems? Then you have a lot of pumping products. We give those products and your concentration goes. We have a simple exercise. Can you all try this ourselves? So I'll just show you the simple. Take your index finger, put it on your nose. Try. Right hand index finger, put it on your nose, look straight to the finger. And just look at the finger and move your eyes right. Then bring it back straight, bring back. Take your finger again straight, take it to the left. Your eyes, only your eyes moving, not your head. How many of you felt something moving here? Be very concentrated. How many of you felt something moving here? That's the concentration. That's a simple exercise to bring back the concentration for the kids. 10 minutes this in the morning, 10 minutes this in the evening is simple. And taking enough of food before the sleep. Even if they are bedwetting, let the kid is not getting up and waking up the parents to go to the washroom. But still, this is how it is. We need the groups to train on health education. Why we are doing this? Why do we need to have this? Why do we need to eat certain breakfast in the morning? Why do we need to eat? Morning you have rice, afternoon rice, evening rice. Next to it, when they are 20, 22, of course they are predictive for lifestyle disorders. Probably that's where we can strengthen, where we can do the health education. Not only for children in school, even for all of us. When the patient goes to a hospital, straight away this girl doesn't know what's going on. She's a primary. And you just have a cesarean section plan. You don't even tell her how the anesthesia is given. We are losing that portion of the education from the doctor to the patient. Simple ways. What is happening in menarche? Not only for girls, even for boys. How they are getting their teenage. What is happening with their body. And why does it happen? Why does their emotional changes come? Why do they deteriorate their whims and fancies? All of a sudden from Cartoon Network they shift on to some other one. They start seeing Star Wars. No, you cannot see this, you cannot see this. No, you can do this, but this is because your hormones are changing. How do we get it? We need education. The child is not talking to the mother, then the neighbor's mother can speak to this child. It's a crisscross. That's what I tell most of them. And most of my friends' children, they talk to me, not to their mothers. Then I pass on the message. I keep the confidence that I'm not passing on the message, but I still try to pass on. So that's where we have to strengthen. So if this is okay, Dr. Sadhana can start the discussion.